Our focus today is very much going to be on the question of what New York City needs to do better and differently and more in order to overcome these challenges in the months ahead. And Dr. Williams, we do these somewhat bilingually, so I'd like to make a very brief announcement in Spanish and then I'll cue you. Saludos de nuevo a todas y a todos. Mark Levine, concejal, con ustedes de nuevo en otra de nuestra serie de charlas acerca de los retos de esta pandemia y los líderes que los están enfrentando. Ustedes son bienvenidos a hacer sus preguntas en inglés, español, el idioma que ustedes quieran. We welcome your questions. We want to hear from you, and you can put your questions into the chat at any point. Please let us know. But now, Dr. Williams, I would like to cue you and thank you for joining us in this important conversation. And before we get on deep into the topic, could you just take a minute and talk about your own path, about your work pre-COVID, because of course you did have a career pre-COVID, and how you wound up as a prominent neurologist at Columbia Presbyterian. Tell us a little bit about your backstory, please, sir.
Thanks so much, Council Member. It's a real honor to be here today. So, you know, my entire career has really been focused on health disparities, and I've always been very passionate. I started my career here in New York City at Harlem Hospital as a faculty, a Columbia University faculty member at Harlem Hospital. I actually founded the Stroke Center at Harlem Hospital. I worked in the Harlem community, made wonderful relationships, have formed great bonds with several prominent people in the community, including our church networks. And it's something that I'm very passionate about. I've always believed as a physician that, you know, 5% of the battle is inside the hospital, and 95% of the battle to keep people healthy is outside of the hospital. And so
that is an amazing concept.
That's what I believe.
Please tell us more about that.
So, because it really is an extrapolation of that prevention is better than cure. If you even look at the data, we are wonderful at curing individuals. We are terrific. This is the world's greatest healthcare system at curing individuals. We have wonderful technology, wonderful cutting edge treatments. But the reality of the matter is that if you can cure people, they're still left with the residual burden of the journey, the years of life lost, the trauma of the experience, the years of
I'm sorry, Dr. Williams, let me just stop. If you can turn off the other mic, because we're getting an echo. Sorry about that, Dr. Williams.
Yeah, so I was just talking about cure. So cure, you can cure someone from cancer, for example, but you still have all the trauma, the years of life lost, all the family, the debilitation, the psychological burden, all the anguish that has gone, that the patient has carried right up until that cure. And all those years are devastating to families and devastating to economies, including local ones. And so the real target of the healthcare system, in my opinion, should be prevention. As we continue to build our capacity to treat people better, the best avenue and the best way is to prevent people from getting the condition in the first place. This is why I'm a big believer in vaccination. I'm a big believer in vaccination because vaccination is a primary prevention strategy. It prevents you from getting COVID in the first place. You know, you could decide to take a chance with your life and get COVID and be at risk of becoming one of those tragic patients that I've lost in the hospital, or you can decide to get vaccinated and protect yourself and your whole family from, you know, becoming, you're just bringing tragedy upon yourself and your family. So as a health disparities, you know, doctor and as a health disparities researcher, it was just a natural evolution from my career to transition from all the work that I've done around stroke, around hypertension, diabetes, all the community-based prevention work that I've done over the last couple of decades. It was only a natural transition that when the pandemic began, and when it took New York City by storm, it was only natural for me to realize that this was going to hit these same, communities the hardest. The communities that I'd been dealing with all of my career were going to be the hardest hit from this pandemic. And so it wasn't even a consideration. It was just a natural evolution of my work to begin to fight that battle on the COVID front lines.
And so that led to your creation of this really inspiring effort known as HipHop Health. Is that right?
HipHop Public Health, yes.
HipHop Public Health, thank you. Tell us about the genesis of that and what this incredible organization is doing.
So again, what I realized very early on that it's really important to connect with the communities that we live in, work in, and hope to influence and hope to inspire to become healthier. The same communities that have the highest burden of a lot of these conditions. But that communication is critical. As a physician who was practicing in emergency rooms in Harlem Hospital at the time, then New York Presbyterian, I always saw patients who I knew, if they had just one more ounce of information, if they had just one more ounce of understanding, if they had just one more ounce of recognizing that there were mitigating strategies that they could take to have prevented the outcome that they find themselves in the hospital on the bed before me, if they had those few ounces, that we could have averted the whole situation in the first place. So how was I going to get those critical pieces of information, the critical pieces of understanding, and the critical recognition that there are options to reversing whatever situation you find yourself in? And so HipHop Public Health was really designed to be that voice that communicates with communities of color, particularly the Black community at the time we started HipHop Public Health, but to communicate in culturally tailored, culturally contextualized, linguistically contextualized, really simplified, clear, concise, concrete, actionable messages that would be absorbed by the community we found ourselves in. And so we needed to have engaging content. And we also wanted to target the youth, because even though it's critically important to target adults, I've always said that it is easier to really create healthy behaviors in a child or a young person than repair the consequences of unhealthy behaviors in an older person. So we wanted to focus on the youth. And so it was out of that process that HipHop Public Health was born. And we took hip hop and all its pillars to use it as a vehicle within which we could embed critical information and critical health promotion programs to really impact the community.
You have, of course, gone viral with your own hip hop message, which we should really drop the link into the chat. I don't know if anyone from your team at HipHop Public Health is on, but let's get that link on there. You have to see Dr. Williams in all his artistic flair, rapping about all this important messaging. But could you tell us, Dr. Williams, what is the message that, when you distill it down, you think really moves people, that connects related to vaccination and more broadly in this pandemic?
Yeah. So one of the things I've learned over the years, Council Member, are that there are three critical pieces to persuasion. So the art of persuasion, persuasion is an art, and there's an art to persuasion. But what have we found that really drive persuasion? So I published an article called the Multi-Sensory, Multi-Level Health Education Model, but it was really based on, extrapolated from a lot of the work that's been done by others, all the way back to Aristotle. And so the three components are really what I refer to as logos, which is the logic, the data, the science that people need to understand, really the data behind the message and why it's important. The second piece is ethos, and that is really the credibility of the messenger, the credibility of the message, and the credibility has a lot to do with the cultural appropriateness, the cultural tailoring, the cultural contextualization, and who's delivering that message. And the third piece is pathos, and that is the emotional connectedness with the message. So it's critically important in our work to have a message that not only is credible, because that to me is the cornerstone of persuasion. It also needs to be supported by the data and the science, but it also needs to be to have an emotional connection with the audience. And if you have those three things, then you're likely to move people towards behavior change.
That is so powerful. So what is the logos then on vaccination? Give us a piece.
The logos on vaccination is that they are incredibly effective. All the vaccinations that have been approved by the FDA in this country are incredible. They will all prevent you from being hospitalized, all prevent you from dying of COVID. And they've all been backed by very rigorous scientific trials that were independently evaluated by so many groups, and constituents, ranging from the National Medical Association, which is really most Black physicians in America are members of the National Medical. They independently vetted the data. Organizations, Hispanic organizations, Black organizations, all independently vetted this data, the scientific data, and then came back to their constituents and said, we've looked at it, we've seen it, and we believe it's safe. And so the logos is that the data is safe. It's based on hard, rigorous science that's been independently vetted by people looking out for us. And that is the logos of the vaccines.
Very powerful. So we have a question along these lines that came in online from Rachel P., who says, BIPOC, meaning Black, Indigenous, people of color communities, have been understandably reticent given U.S. history of mistreatment. There seems to have been some inroads made in increasing trust among BIPOC communities through encouraging folks to talk to their doctor and through celebrity campaigns. So I guess her question is, given what seems to be some success with those strategies, who's not being reached by that? Yeah. And what are some suggestions to lower the barriers to reach those who have not yet received this message?
So I really think that a lot of there's been tremendous progress, as your guests indicated, and I'm very pleased by that. But I think I predicted from the very beginning that we're going to see what we call early adopters, and these are folks that are typically the low-hanging fruits, and there's some more intermediate adopters that follow closely behind the early adopters, and those folks have all come in. Now we're dealing with folks who have much lower vaccine confidence. And how do we reach those folks who have lower vaccine confidence? All the messages that we've put out there hasn't clearly reached them. All the campaigns clearly hasn't reached them. How do we reach these individuals? And I believe that two things that we need to do. One is to apply the kind of like the triad that I described of strategies, continue to apply that credible messenger, emotional connected, continue to apply that. Two is to make access almost ubiquitous.
Yes.
Make it ubiquitous so that, if you go to the barber shop and you can get vaccinated, could
that really be done? Like in barbershop,
anything is possible, right?
Yeah.
Right. There are walk-in vaccination sites everywhere. Like you walk down, every block should have a walk-in vaccination site in these communities that are difficult to really gain that trust. If there's a vaccination walk-in site at every block, every couple of blocks, and then you're going to be walking past these places every day, and you're going to see lines and people walking in every day. And so it becomes so easy for you to one day just decide, I'm gonna go in, because it's right there on your block, on your neighborhood, and you walk. So I think we need to do a much better job with access, especially in these communities. We need to make it ubiquitous.
Yeah.
And then I also think we need to micro target. And the way to micro target is kind of more similar to the way voting registration works, right? We need to have people on the ground the same way that, folks are trying to get you to vote for X or Y or Z. We need to have people on the ground having one-on-one conversations. When we have a vaccination site, as you know, council member, in West Harlem at the Forum.
Yes.
And one of the things that we did, me and some of my fellow physicians, is that we walked out onto the street, and I walked into several of the housing projects. We walked up and down 125th Street, through a lot of the different housing projects, NYCHA buildings, and I was having one-on-one conversations with people. Wow. I must have spoken to 80 plus people over the weekends that we've been there. And these conversations are very illuminating. I'm in my scrubs, I'm on the street, so people are asking me, having real conversations, I don't trust the vaccine. The vaccine is X, Y, and Z, and they give all these very, very good reasons, historical reasons about why they don't trust the vaccine. And I sympathize, I empathize, because look, you're looking at a Black man, right? And so I share that pain, and I share the experience of discrimination. I've experienced it myself, and because no matter how high up you are in the socioeconomic ladder, if you're Black, you will experience discrimination and racism. There's no question. And so I share that pain, that feelings of mistrust. So I was having these one-on-one conversations with a lot of people in NYCHA residents and on the street. And do you know that probably for every 10 people I spoke to, I was able to get one person to go get vaccinated.
Wow.
Just by having one-on-one conversations.
Right.
And there was a walk-in. We just walked down to the corner of 125th and they went to get vaccinated. And this tells me that if we only did more, and I respected the individuals, so some people said, no way, and they walked away from me. Some people said, let me think about it. And some people I had that conversation with, and they said, I'm gonna go do it. And I walked them to the vaccination center and they got vaccinated. And we cheered and we said, fantastic, we congratulated them, etc. But I think that we need more credible messengers on the ground in these communities, having those one-on-one conversations, one-on-one on the street, in their homes, in their buildings, one-on-one conversations with residents. And I think if we begin to do that, we might actually end up vaccinating a real influencer on that block.
Right.
A real influencer.
And then there's like a multiplier.
And then there's a multiplier effect.
Right. Yeah. So we actually have, it turns out we have a prominent nurse, Marva Wade, she's retired now, who just commented, sort of agreeing, I want to get her exact words, but basically agreeing that, people aren't going to leave their neighborhood, they're not going to travel to get vaccinated. And I want to emphasize the extent to which New York City is not there yet on access being ubiquitous and barrier-free. We're not even to the level of a normal flu vaccine campaign. In flu season, any doctor's office you go into, if you're in the doctor's office or any appointment, they'll give you a flu shot. And for example, we still don't have, most private doctor's offices still cannot vaccinate. Now that is improving, and there are hundreds which are now doing it. But in flu season, you can just be, at your local pharmacy picking up, a bottle of aspirin, and on impulse, you can just go and get your flu shot. Or you can be picking up a prescription and the pharmacist will say to you, you need your flu shot. And unless I missed it, we still don't have walk-in vaccination at pharmacies. And then there's the things that we need to do beyond those kind of like fixed institutions, which is mobile vaccine clinics. It's not for everybody, but there's some folks, like if it's parked in front of your building, that could be the moment. And also vaccinating in trusted locations, like in a church or in the community center in your housing development. And we have a lot more to do. Do you have any other thoughts on kind of specific access strategies that we need to be pushing?
No, I agree entirely with what the strategies you mentioned, council member. And if we could only implement what you just suggested, fully implemented, not half implement or partial implementation. We fully implement those strategies, I think we'll begin to see increased numbers, better numbers, because right now it's still, believe it or not, we've done a lot. We've come very far with regards to access, but in the communities that really are struggling, it's still grossly insufficient.
I'm afraid so. So let's see, we have a question about NYCHA buildings. So Jack is asking, NYCHA buildings have been hard to get outreach into. What can the city do specifically focused on NYCHA? Do you have any thoughts on that front?
Well, again, I think it's important that, I know that some community boards have been organizing vaccination drives in NYCHA buildings. And I think it's good to make sure that we have vaccination pop-ups in the building itself, downstairs. And, I'm one of the co-investigators of a grant that is providing screening to NYCHA residents, glaucoma screening. And our community health workers basically work with 10 NYCHA housing buildings, and they set up downstairs, and they perform screening for glaucoma, and they give out glasses, and they do visual cue. They give out glasses, and they perform screenings right there.
Incredible.
And so many people that we screened have never had their eyes checked. Right, but we're right there in the building doing the screening. And I think for vaccinations, we need to be right there in the building, vaccinating people downstairs. Anytime you're walking out of your building, you're seeing the vaccination site. And so I think we definitely need to do more of that with NYCHA Housing. And I think we also need to create champions within NYCHA Housing, identify the real influencers, identify the leaders in the building, and really empower them with the skills to become real effective champions and have them work.
Yes, I compare our effort to date to the city's effort to promote census participation, which was quite extensive. And even in the midst of what was the worst of the pandemic, remember Census Day was April 1st last year, New York City had a higher response rate than a lot of other major cities in the country. And we did it by pouring tens of millions of dollars into outreach. The city contracted with well over 150 community-based organizations just to do outreach. That's above and beyond the official Census Bureau people who went door to door. This is people whose job was to go to tenants association meetings and community board meetings and whatever the topic of the meeting, to take a minute to speak up about why the census mattered and how easy it was. We haven't had that scale of an effort yet on vaccination. And I guess, do you have any thoughts about mobilizing the existing infrastructure of community groups, whether they're faith-based or group supporting immigrants or tenants groups or hunger relief? There's just an amazing constellation of existing institutions.
I agree fully. Yeah.
Please. Yeah.
I agree. And the reason why I agree fully is because, we did it with the census, as you clearly pointed out. But we have to also make sure that we give the funding and the support to do this work to the right groups, right? We can't give it to the same groups, right? The same groups. And it's important to recognize that there are new players out there. And when you're dealing with the youth, there are new systems out there. And so we have to understand that. I think working with the churches has been fantastic, and we see 80+% of our seniors vaccinated, right? Those are part of the early adopters, right? But what about the young people, right? They're the ones most likely to spread COVID. Which community groups, which CBOs are targeting the young people, right? And how do we get empower them with the resources to do this work with young people? And so it's not just a traditional, we're going to give it to the churches, we're going to support these churches, these large churches. Well, that's great. But a lot of the people the churches have influence over, that they've come in, and they're still coming in. We need to be much more, much more inner creative, and we need to reimagine the old strategies and say to ourselves, who are the new players on the streets? Who are the new influences on the streets? And we have to identify, because they might not even be interested in looking for a grant application to apply for funding to support this work. Right. We have to be proactive and find them and engage them and support them in this work.
Yes, I absolutely agree. So we had I think it was an anonymous question on the chat about incentives. And so famously now the governor of West Virginia is offering a $100 savings bond. I think the county executive of Erie County in upstate New York, they give you a voucher for a free beer. He's calling it a shot and a chaser. So how do you feel about incentive programs like this?
Well, I don't think we should be, I don't believe in gimmicks, and I don't believe in things that are not sustainable. I think if we're going to create incentives, the incentives should be incentives that fix the social determinants of health, that address the problems, the conditions that these individuals are in. How about giving them health insurance? How about helping them with their housing, with their food insecurity? How about help creating an equitable system in which they live so they can have equal opportunities to. So I really believe that, giving someone $100 to get vaccinated is not going to transform the long-term conditions that individual is living in. And if there is money out there to start giving people, we should use that money wisely, more creative. We could use it to change conditions, right? If people see you care, if people see, wow, the government is really helping to change the conditions and lift me out of poverty, they're more likely to trust that government than that government saying, you take $50 and you get vaccinated and I'm going to leave you in your conditions. We need to make a really honest faith effort to help people in the long term, not just in the short term. And if we begin to show that type of empathy and that type of commitment to equity and to the conditions, then I think it'll be much easier to get people, not only to just get vaccinated now, but they're going to be future pandemics. There's currently pandemics within the pandemic. And we need to make sure that we're in the position to provide the type of incentives that actually change people's conditions.
And, along those lines of kind of investment in more systemic solutions, Aisha Langford has a comment in the chat. We also need to properly fund our public health departments, both locally and nationally. They do such important work, which often includes community health workers and public health nurses. And the truth is, America has underfunded public health.
Yeah.
And we paid a price over the past year.
I'm always scrapping for funding. It's one of the things I spend too much time doing is looking for funding. I run a program where I recruit community health workers from churches, and then I train them to become community health workers. And then they go back to their churches to really help, in all types of health-related activities within the churches. I fund the training for these community health workers, and I fund a lot of the resources that they need to become community health workers. And then I support the community health workers when they go back into their churches. Wow. So we've trained about 130 community health workers.
Incredible.
Over the last couple of years, representing about 52 churches in northern Manhattan, and they do tremendous work. But imagine if these types of programs were funded. Imagine, because I truly believe, council member, in capacity building. I truly believe that if we built capacity around health promotion, around health prevention on the ground, it would reduce the need for us to even be in this situation in the first place. Because those folks, that infrastructure, that investment in community health workers and navigators and these folks that are embedded within the community, if we invest in creating that grassroots infrastructure, then whatever comes next, they would be our conduit. Whether we're dealing with an epidemic of diabetes or we're dealing with a challenge with cancer screening, these individuals that are empowered and trained and given the resources, who the community trusts, they will be our go-to people, and we won't be scrambling at the last minute to find out who can help us.
You know, Marian Kroskoff has a comment about just how important it is to piggyback vaccine outreach with addressing social determinants of health. And she points out that just getting people health insurance would be a huge benefit. And it is still appalling that we live in such a wealthy nation in which there are millions who still lack the basic security of health insurance. And you could see the price we paid, the underlying conditions which drove this pandemic. I have no doubt there's a correlation between whether you have primary care and preventative care and an annual physical and early detection, et cetera. And, you know, it's amazing how much access to healthy food is connected to the conditions which make someone vulnerable to COVID. And it is still true that healthy food is less accessible and not affordable in uptown Manhattan and communities of color more broadly. So that work we need to redouble our efforts on that work.
And if we don't, we're going to struggle with the trust gap in perpetuity, because we have neglected communities for too long. Structural racism has caused marginalization, and marginalization has created the conditions that we find right now in America, the richest country in the world, where some people can't afford to eat and other people, you know, are looking for places to throw away their food, right? And so if we invest in dismantling structural racism and improving the conditions, I mean, it makes me angry, council member, that in this country, the lines outside of food banks, wrapping around block off the block. When I would drive or walk past these lines, I'm like, where am I? Is this the United States of America? When I see those numbers climbing every day, you know, 100,000 deaths. We lose more people. We were losing more people every day than we lost in 9/11, right? And when I see the numbers climbing up towards 600,000, you know, and climbing, I ask myself, how can this be? And the reason why this is we have not invested adequately in the health system in general. We've invested heavily in technology, and we've invested heavily in cures, but we haven't invested heavily enough in prevention, because you know what? We make more money from curing a patient than preventing the disease. If a diabetic patient develops a foot ulcer, I will make more money from amputating that leg than I would make from preventing the diabetes from coming and causing that foot ulcer. The incentives are skewed, and they are, quite frankly, immoral. We need to invest just as much in prevention, if not more in prevention, in the healthcare system, period. And number two, we have to address the social determinants of health. We have to. Otherwise, and one of the things about COVID that I think has woken people up, they've woken people up to the fact that we are all connected. We are all connected. When I walk into a patient's room to see a patient, as the physician, I could expose that patient to COVID. The cleaning lady who comes in to clean that patient's room can expose that patient to COVID. Yeah. The janitor, right, who is, taking care of all the supplies in the basement could expose the cleaning lady, who can expose the nurse, who can expose the doctor. So all the way up the food chain, right up the ladder, we are all connected. Whether you're working as in the sanitation, or you're working on Wall Street, we are all connected. And for the first time, America has finally seen that what happens in Harlem can affect the Upper East Side. And they didn't get that before. People thought they could live in their bubbles, but people have now finally realized that what happens in that community that I have ignored and it has been invisible to me all these years actually affects my bubble. And so we need now to recognize the moment, and the moment is to come together as one people and address the social determinants that we all suffer from.
This does have to be our moment. Just like after Superstorm Sandy, we invested billions in resiliency. After 9/11, there were untold billions that went into security. This has to be the moment to address inequality in health and in society more broadly. My goodness, it is so inspiring to listen to you, and I'm very happy that we are recording this. We had someone asked earlier whether there'll be a recording available. Absolutely, we'll post this. It'll be available this evening because people need to hear your powerful and challenging and inspiring message, Dr. Williams. This idea that we're all connected now, it's very relevant in vaccination. And I'm worried that the half of the city that's already vaccinated is going to move on and feel like we don't have to stress anymore about this pandemic. Could you explain to us why that kind of thinking would actually be very dangerous?
Sure. So to do that, I'm going to explain how variants emerge. But even before that, I'm going to explain what happened in Brazil. So in Brazil, there was a small village in Brazil, and they all got COVID. So most folks had COVID, and so they developed, convalescent antibodies and immunity to COVID. But what happened, despite the herd immunity, which is the community immunity that village had, was a new variant emerged in another part of Brazil, and that new variant had the ability to evade the immune systems of those who were immune and reinfected half the village. And so these new variants are very dangerous. Fortunately for us, both the UK variant, the South African variant, and the Brazil variant, fortunately for us, the vaccine does have efficacy against them, but there's only a matter of time before, God forbid, we have a variant that evades these vaccines and does to us what happened in Brazil. Now, how do variants emerge? This is the question. Variants, when you're infected with the COVID virus, when you're infected with the coronavirus, it hijacks your cells. It just hijacks your cell and turns your cellular apparatus into its own factory. And it starts to make copies of itself. And that's how it replicates in your body and spreads and overwhelms your body. It makes copies of itself by hijacking the cell apparatus in your own body. Once in a while, as it's making a copy of yourself, there's what we call an error in the copying. That error is a mutation. And so the copy that emerges is not the same as the original copy. Once in a while, the copy that emerges is more infectious, is more elusive to our immune system, is more evasive to vaccines. And God forbid, one of these copies, these mutations that happen in a community that's largely unvaccinated, that's where spread happens. Replication happens rampantly in unvaccinated people. That's why they get sick. So if you have an unvaccinated group, a community, or cluster, the virus has more chance of mutating because it's replicating at will. And once you get that mutation that creates a variant, that's how we had the UK variant, which was more infectious. That's how we had the South African variant. And we have an Indian variant now, because things are going pretty badly for India.
And there's a New York City variant as well.
And the New York City variant. If we get a variant, God forbid, that is not just more infectious, that is not just more deadly, but that it also is capable of evading our immune system, you know what happens to all of us, whether all of us who've been vaccinated? We're back to square one. We call this the doomsday scenario. Scientists like myself and physicians, we call this the doomsday scenario. That's why we say we are in a race against the variants. We are in a race against the variants. So it's critically important for vaccinated people to recognize that we have to really inspire and help usher along unvaccinated people to become vaccinated, because we are in this together. We can't, there's no bubble here. We are in this together.
Does the presence of P1 in New York City, which is I guess, one of the Brazilian variants, or if not the Brazilian variant, how worried about that are you?
I mean, I'm concerned about all of these variants, but we do have some evidence that at least among the current vaccines, that there are sufficient amount of neutralizing antibodies produced against that variant that should keep us protected. And with the boosters, we'll have even more protection.
So this is not a question, but I just have to read a comment from Eileen Flynn in the Q&A. I don't have a question. I just want to say I'm glad to attend this wonderful event. Dr. Williams is a doctor who speaks to ordinary people, those from marginalized communities. Dr. Williams, you are powerful. You need to be heard by governments all over the world. So that is, amen. Couldn't agree more. And we have a comment from Sarah in the Q&A. It says that Walgreens announced today they're introducing mobile clinics with same-day appointments across the country. Do you see this as being more attractive options for young people in the city as opposed to making and sticking with appointments? I think we know the answer, but feel free to weigh in on that one, Dr. Williams.
Yeah, no, absolutely. Definitely mobile clinics are terrific. Same-day appointments are great, but we also need walk-ins. We need to make sure that we emphasize walk-in. Walk-in is the barrier of making an appointment is still a barrier. We need to have as many walk-ins as possible. People should just be able to come in and get vaccinated.
Yes, exactly. So I've talked to some public health leaders who are anxious for there to be some sort of system that requires vaccination for sectors of employment or attending entertainment events, partly to make those venues safer, but also to give people a reason to get vaccinated. And you could soften it a little bit by saying, if you work in a healthcare setting or a nursing home, you either have to get vaccinated or you have to show a regular negative test once a week. If you want to go to a Broadway show, you either got to show you're vaccinated or show you had a negative test in the last 24 hours. How do you feel about those strategies from a perspective of incentivizing vaccination and more broadly?
I actually like those strategies, Mark. I actually do. I think that it's a powerful incentive when, I'll just give you an example. So, I work with a lot of artists, I got a call from one of my artist managers who said, I got to get X vaccinated, this month because he's doing a show at this arena next month, and they're only going to let him in if he's vaccinated, right? And so that was a big driver for this particular individual to get vaccinated, right? And so there are so many different drivers to motivating people to get vaccinated, and I think we need to embrace all of them, right? I think we need to embrace, because we're talking about something that is critical for society's continued progress, both economically and from a physical health perspective. And so I like these incentives. You know, when you get on a plane, you have to provide a negative COVID test, and then you can get on the plane. So when, you know, if you have a private venue, you should be able to request that the person either have a negative COVID test or is vaccinated. And this will hopefully make unvaccinated individuals realize that, you know, I can't be getting a COVID test every time I want to do X, Y, and Z, right?
Exactly.
Maybe I'm just gonna look into this vaccination thing a little deeper. Maybe I'm gonna actually speak to someone who I trust to ask a little bit more, learn a little bit more about this vaccination thing. And so I do think that these are important initiatives, and I think they're gonna help some people cross the line and get vaccinated.
I've definitely talked to young people who are not anti-vaxxers, but they don't feel urgency. They haven't gotten around to it. You know, life is busy. But this could be the kind of thing that they say, okay, I'm going to do it because I want to go see a Knicks game and I don't want to have to get tested every time. And look, I also think that there's a safety factor. You know, let's say you have, God forbid, an outbreak in a house of worship, and then they need to start instituting this kind of system. But particularly, I think in healthcare settings, and we did have a question earlier about sort of the challenge in healthcare settings in getting, not the physicians. The physicians really, I think you guys are like 99.9% vaccinated. But as you pointed out, you have all sorts of different professional levels there. Any thoughts on maybe it's a requirement of the type I mentioned, or what can be done for healthcare workers who are still not on board with vaccination?
So, I mean, I think that I do think that I think very soon these vaccines are up for full FDA approval. Right now, it was the emergency use authorization, but I believe over the next few months we're going to see full FDA approval.
Right.
And when we see full FDA approval, at that point, we're going to see a lot of hospitals mandating the vaccine. Almost like now, as a healthcare worker, we have to, you're exempt for religious reasons.
Right.
There are exemptions. Right. But it's generally you need to have the flu vaccine if you're a hospital or healthcare worker, because we have a lot of sick, immunocompromised patients. Whether you're a cleaning lady going into the room or a janitor, you don't want to bring flu into the room of an immunocompromised patient. They could die. So we have to all be vaccinated unless you have certain religious exemptions. And once we get the full FDA approval, I expect and I suspect that we're going to see a lot of hospital systems requiring COVID vaccinations for their staff with these minor exemptions. And when that happens, we'll see the numbers go up right the way through the levels of healthcare hierarchy.
Is there a projection on when the final approval will be?
I've heard from some of my colleagues that it's going to be within the next few months, but I don't have an exact timeline. And
there's also word that there could be emergency use authorization for younger people from age 12 to 15.
Yes.
And that might actually be imminent. Yes. And that raises a whole new set of questions about helping parents feel comfortable getting their kids vaccinated. I guess to some extent, if the kids have agency, helping the kids feel comfortable. Have you started to think about what could be the next big wave of vaccination?
Well, I mean, I think the school systems, we're already seeing a lot of colleges now requiring vaccinations for everyone coming into college. My son will be starting college in the fall, and he's going to be required to be. He's already vaccinated, because he's the age that he can be, so he's already vaccinated. But his entire class is going to be required to be vaccinated. Once we move from 12 to 15, we're going to now see middle and high school students and a lot of institutions requiring that vaccination for those age groups. And so you're going to start seeing, through the lowering of the age, you're going to start seeing a lot of structures, a lot of institutions in educational sector, especially requiring vaccination for these young people. And once these young people start getting vaccinated, because through these requirements, then I think that it's going to set off a cascading effect that normalizes the process in terms of it becomes a social norm. And that social norming is very important because it diffuses through by its very definition, it's now normalized. It diffuses through the entire family unit.
So we have a comment in the chat from someone who I deeply admire, and I'm sure you know well, Dr. Williams, Dr. Uche Blackstock, who has emerged as one of the leading voices in this pandemic nationally. And first, she has some news. Apparently, while we've been on this Zoom, the FDA is set to authorize the Pfizer vaccine for 12 to 15-year-olds by early next week. So that is very exciting. But she also has a comment that I'd like to read. She says, I think many of the healthcare workers from LTCFs, forgive me, this is, that must be a terminology for the
long-term care facilities.
Okay, thank you. And similar settings had low vaccine uptake for the same reasons as many in BIPOC communities. They don't have workplace protections and are not paid well. I think they would benefit from peer outreach from their coworkers who did take the vaccine, but we should also focus on ensuring in the long term a living wage and paid sick and family leave. What an incredibly important point.
So we've done just that. So, I'm part of the vaccination committee at Columbia. So what we've done is that we have a what we call a vaccine champion program. So with every department and every division, right down to the secretarial staff, security, we have peers within those groups that have been vaccinated that we've recruited as champions, trained them, because you got to know how to speak to people when it comes to the vaccination. You can't judge people. There has to be, we have to use what we call motivational interviewing. It's a scientific term for really how to bring people along at their own time through a process of reflection rather than kind of prescription. And so we're training our vaccine champions at all of these levels, right down to the secretarial, security level, on how to do motivational interviewing, how to counsel people, how to encourage people, and then these peer champions are doing that work for us as credible messengers and peers within all those units, all the way down the ladder of the system, in our hospital. And that seems to be a very effective approach, because peer-to-peer is critical, is very, very powerful when you're dealing with these types of interventions.
So related to this news breaking on young people, we have a question from Becky McCauley. I work for an after-school program where we have some caregivers who are enthusiastic about the vaccine, but have more questions regarding the vaccine in children, such as the effect on growth. How would you advise we address these questions?
Well, I think it's going to be really important to really, have, parental engagement. It could either be through a parental town hall, or I actually did an event with the Promise Harlem Children's Zone a few weeks ago, where I was on, and one of my colleagues was on. She's an infectious disease expert, and we had a whole town hall with Harlem Children's Zones, answering questions, really engaging and really providing these types of the explanations to questions. And so I really think it's really important for these forums to be available to parents, so that they can ask these questions in a forum that's with the right experts in the room who really know how to communicate, so that all their questions can be answered. And then there could be a series of these forums created, because you're not going to get everyone that first day, but if you have these kind of series over time, ultimately, more people will get informed and have their questions answered by the experts, who hopefully will look like them and have their experience. And maybe some of them even have a child in that school, or has a child who's been vaccinated. But I think it's important to provide these opportunities to parents and stakeholders, so they can actually directly engage the experts around these answers.
We are almost out of time. So very, very quickly, can you just address this concern to the extent science has an answer on whether people should be concerned about vaccines impacting the growth of kids?
No, I don't think so. I think that the data the data doesn't suggest that we should be concerned about that at all. The mechanism of the way the vaccines work don't point to any major concerns that we should have. And we should also recognize that these mRNA vaccines and a lot of these vaccines have been in use for a long time. The mRNA technology has been around for more than a decade. The adenovirus vector approach has been around for decades. And so we have a lot of experience with a lot of these vaccines, and the signals that would have pointed us in the direction of concern for an effect on growth would have been apparent in all the work and experience that we have with a lot of these vaccines. So I don't think that there is any need to be concerned that any of the current vaccines will affect the growth of children.
And finally, let's get back to HipHop Public Health. And could you tell us about the resources that are available through the organization that regular New Yorkers can use to share with their friends or bring to their community organization? Tell us what's available for the public.
Absolutely. So we have a series called Community Immunity that is about really taking people on a journey through vaccination. They're short 1-minute videos that features a DMC from Rum DMC. And I have to confess, I'm also I'm also spitting
Yes, you are.
spitting some verses on that. But Run DMC from Rum DMC is the lead artist. We have a gospel singer, Tommy Gunn, on it. We have an incredible producer, multi-platinum producer, did a lot of work with folks like Ja Rule and Ashanti, who produced the track. Each video is 1 minute long, and there are 5 of them. And it's supposed to take folks on a journey. The first one is, what are vaccines and how do they work? The second video talks about how do we know the vaccines are safe. The third video touches on misinformation and some of the misperceptions around the vaccine. And the fourth talks about some of the side effects of the vaccines and what to expect if you receive the vaccine. And the fifth and final one really talks about why is getting the vaccine better than getting sick from COVID-19, and then touches on herd immunity. And if they're 1 minute, you can download them for free. All the resources of the HipHop Public Health are free of charge. You just need to go to our resource page, and download them. You can show them in your community meetings, show them to the youth, show them in your schools, show them, at town halls, and they're supposed to take you on a journey of vaccine literacy.
And it looks like someone just posted in the chat the link to the Community Immunity webpage. So please check it out. Dr. Williams, this has been an incredible hour. I am so grateful for your time, and more importantly, grateful for your leadership on these critical questions of equity, of access, of clear communication, and really thankful that you've spent time explaining to us the urgency of this moment. And I want to thank everyone for joining us for this conversation. We'll be back soon for another Q&A, but I'll allow you to give a last closing word, Dr. Williams, and then we'll close it out.
No, I just want to thank you, Councilmember, for having this. This is a really great conversation we had, and I just want to say that there is hope. There is light at the end of the tunnel. I think that we are on our way out of the darkness that we've experienced together, and there's definitely hope on the horizon. And I think we should still continue to reach for it. We should not be dismayed. We should not be disillusioned by the persistence of the virus in our societies and the continued death that we're experiencing among us. That's just a reminder for us to continue to wear our masks, continue to socially distance, and try to get as many of our loved ones vaccinated as possible. And to those who have lost loved ones, to those who have experienced tragedy as a result of this pandemic, I want to say that my heart goes out to you. My prayers are with you. We are here for you as physicians, and we are here for you as human beings. Thank you so much for having me.
What a powerful and beautiful note to end on. Thank you again, Dr. Williams. Thanks to all of you for joining us, and we will see you again soon. Thanks, everyone. Be safe.